At 5:30, a decline in life expectancy across Metro Louisville was just released from a new public health dashboard that's coming from the Metro Health Department.
There is still a big difference in life expectancy depending on where you live in the Metro. Ian Hardwitt and photojournalist Alyssa Newton look at the numbers and see how it's being addressed.
75 years. That's the average life expectancy of a Louisvillian, according to the Metro Department of Public Health. However, the data differs depending on where you live. West of 9th Street, the average is 65 years. And in the East End, it's 81, a disparity of 16 years. Those numbers come from analyzing 2007 to 2021, so COVID is still a factor in the total number of deaths. However, heart disease and cancer were still the main causes of death for people living in Louisville's most at-need communities in the West. Louisville Urban League President Lyndon Pryor acknowledges the different ways location can factor into the problem.
Environmental things, where a plant is going to be located in a city. And so environmental justice issues, air quality, water quality, all of those sorts of things impact somebody's health in real terms.
And the health department agrees. They say stress, specifically over reliable and affordable housing, leads to heart problems. They also identified exposure to carcinogens like polluted air as part of the increased risk for cancer. Norton Healthcare is bringing a hospital to 28th and Broadway, the first in the area in over a century, which will lower the barrier to accessing preventative care. Pryor says one obstacle they'll have to overcome is trust.
That they're willing to do better and be better by the communities that they're in.
Russell Cox, Norton's CEO, insists they are doing better.
I think for so long in healthcare, we as an institution have said, here's what's good for you. That hasn't always worked. So we decided we were going to look at it a little differently this time.
From community feedback sessions, they're determining what to offer at the new hospital site, such as pediatric and maternal care. But the health department's numbers still worry him.
As discouraging as this report is to someone in healthcare, it is equally as encouraging to understand that it can be overcome by working together on these things.
In Louisville, Ian Hardwitt, WHAS 11, on your side.
The city created this health dashboard to analyze health equity in Louisville. It was released as part of the 2023 health report, but they want to keep it updated with local data. You can find a link to the site to explore it for yourself on the Louisville Department of Public Health and Wellness website.